Welcome to DermWire News powered by DermWire.com. DermWire News for Smart Speaker is made possible with advertising support from Ortho Dermatologics. I'm Paul Winnington, Editorial Director for Practical Dermatology Magazine. New guidelines from the American Academy of Dermatology for management of melanoma say that there is insufficient evidence that pregnancy increases a woman's risk of developing melanoma or affects the prognosis of the disease. The guidelines indicate that any decisions regarding the management of melanoma in pregnant women should be based on patient health and disease stage, while counseling on future pregnancies should be based on the individual's history and melanoma risk. The guidelines also recommend that patients with a family history of melanoma receive education and counseling about genetic risk. According to the guidelines, formal genetic testing may not be appropriate and should be considered on an individual basis after the counseling discussion. Surgical excision remains the gold standard of melanoma treatment, while Mohs surgery or other forms of staged excision may be considered for certain subtypes of melanoma on some parts of the body, the guidelines state. Although topical therapy or traditional radiation may be considered as second-line therapy in limited cases when surgery is not possible, the guidelines do not recommend electronic brachytherapy for melanoma treatment due to a lack of scientific evidence. Xylo Therapeutics' patented nanopod aerogel delivery technology was used to demonstrate the efficacy of endocannabinoids in a model of cutaneous lupus in a study presented last month at the meeting of the American College of Rheumatology. The presented study evaluated local application of the endocannabinoid anandamide using nanopod delivery particles in lupus-prone mice. Mice treated with the releasing nanopods had significantly fewer and smaller skin lesions compared to both control arms. Interestingly, this improvement was noted both where the nanopods were directly applied and where they were not applied, such as on the face and snout region. The data demonstrate that topical administration with AEA-releasing nanopods significantly prevents the development of cutaneous lupus erythematosus in a well-established animal model of lupus. This work also reinforces the rationale of targeting the endocannabinoid system for autoimmune rheumatic diseases and the utility of using the nanopod delivery system to enhance efficacy. Thank you for listening to DermWire News powered by DermWire.com. This editorially independent program is supported with advertising from Ortho Dermatologics.